What's up, everybody? It's Ian the Fit Medic here. I wanted to make a short video. This video is not going to be heavily edited. I just wanted to get it out as soon as possible. This video is going to be on the novel coronavirus, or COVID-19. This is a current pandemic alerted by the World Health Organization as of about 2 days ago. I wanted to make this video because I'm seeing a lot of people go into a state of mass hysteria and be incredibly stressed by the announcement of this being a pandemic. So to use a Paul Brodier quote, "Statistics are human beings with the tears wiped off." And what that means is we're going to look at the numbers. We're going to look at the suggestions of the CDC and the World Health Organization. And I'm going to try to disseminate that as best and as concise as possible for you guys. Why this is important is there is a lot of information being circulated from multiple sources, heavily from the news. And at the end of the day, the real only place you should be getting your information on stuff like this is from the CDC if you're in the United States, or the World Health Organization. And why that's important is the more that we stress, the more that we act sometimes irrationally, the more that we will stress different systems that are already stressed trying to deal with a pandemic. One of those systems being the health system is heavily stressed right now because of it, as well as grocery stores and other stores like that. People are just buying things up, thinking that we're going to be in a scenario similar to I Am Legend or any of the hundreds of pandemic movies out there. Real early on, I want to say that I'm not trying to belittle this disease in any fashion. Any disease with a mortality rate is serious to people that have it. But we need to look once again at the appropriate sources, because if fear propagates, it just makes the whole scenario worse. We can handle this in a very logical and productive fashion without having to stress, without having to go into hysteria. On an individual level, the more that we stress, the more that we actually make ourselves more prone to becoming recipients for different diseases, not specifically COVID, but just getting sick in general. The more we stress, the more we lower our immune system. As well, it's just not good for our mental health to stress as much as we are. This doesn't mean that we can't take the appropriate precautions, but we can do so, once again, with the tears wiped off. We don't get in a car, put on a seatbelt, and have a panic attack. The reason being is that seatbelt is a logical decision to take a precaution in an environment that has higher risk. Right now, all the recommendations that we are following and our governments are following per the CDC and World Health Organization is a seatbelt. It's an appropriate precaution that should limit damages done and injuries sustained. We don't need to stress ourselves out further when we're taking the appropriate measures. And when we take these appropriate measures, we end up fighting the pandemic appropriately. We flatten the curve, as you may have heard, which just means opposed to the infection rate skyrocketing, we start to flatten it out and then it starts to diminish. These are all appropriate phases within public health and epidemics and pandemics. I'm not going to go into detail of them, but we're just trying to get to the point where it starts to flatten out and then dissipate. We follow the appropriate precautions announced by the appropriate organizations, once again, CDC and World Health Organization, and we're going to do just fine. So firstly, let's talk about the pandemic word and what that really means. It just means that it's something that has broad-reaching implications and has a sustainability from host to host. It's no longer just one source contracting other people. It's spread across a broad area and multiple continents and countries. And for the current numbers, and I checked these yesterday, which would be March 13th, the up-to-date numbers per the CDC, the current infection rate is 1,629 infections with a total amount of deaths of 41, which gives us a 2.5% mortality rate. Per the world and the World Health Organization, there are 136 4,895 cases, 5,077 deaths, with a mortality rate of 3.7. And it's hard to put these numbers in perspective, so I'm just going to look at a commonly brought up disease, influenza, that people tend to try to piece it together next to. Currently, per the CDC, from October 2019 to March 2020, there has been 36 million to 55 million cases of the flu, with 22,000 to 55,000 deaths. That equates to a mortality rate at the low end of 4%, with the high end up to 15%. So right now, we actually on the low end have a higher mortality rate in the US with influenza than we do with COVID-19. And the weekly update and numbers for influenza is actually 7.1% mortality rate just this week. With what that means is it's just below an epidemic. 7.3% is the threshold for an epidemic. And I'll put up a chart here to kind of show how it waxes and wanes and what the mortality rate curve looks like associated with the flu season. Now let's talk about the risk, because that seems to be where everyone has a perceived susceptibility. Everyone's very stressed because they think they're going to get it or come in contact with someone who has it. Per the CDC, the immediate risk for infection is still low for most Americans. Of course, there's an elevated risk if you work or live in an area that the COVID-19 is more prevalent, which just makes logical sense. And there's an increased risk for healthcare workers, people who are in close contact with COVID-19 patients, and travelers returning back from the list of places that are higher risk for infection. I'm going to put links, a series of links below to the World Health Organization and the CDC, and some YouTube videos by them on the information I'm pretty much disseminating for you today as well. Now, for patient demographics that are higher risk as well are the elderly and people who have comorbidities. These are things like diabetes, lung disease, and heart disease. Now, let's talk about the recommendations per the CDC and World Health Organization. I'm going to start out with just the population demographics I just talked about that are at higher risk, the elderly and the patients with comorbidities or other underlying conditions. If you are part of this demographic, this is the only population that should be going out of their way to stock up a bit more per the CDC. And the reason being, if they get infected, they need to then quarantine in place, and they won't have the ability to go ahead and go to the store by themselves. And they may not have somebody to go to the store for them. So those people should be prepped and ready to go if they need to quarantine in place. But no one else needs to be going crazy at the grocery store. And if you do go crazy at the grocery store, you are possibly taking away resources that are needed by the populations that may need a quarantine in place. CDC also recommends that you take everyday precautions to space yourself from other people. When you're in public and you have to go in public, limit the interactions you have with other people as well as people who are sick, and wash your hands often. Once again, avoid crowds as much as possible. Avoid cruise travel and other non-essential travels. And of course, stay at home as much as possible to avoid any possible infection, being a higher chance of becoming infected. And now for everyone, not just the people that are of higher risk, the CDC recommends washing your hands for 20 seconds and washing it regularly. If there is no soap available, then you can use a hand sanitizer of 60% alcohol or higher. And to sound like a broken record, but I'm just repeating the guidelines of CDC, social distance. Create social distance, stay home. If you feel sick, stay home. Cover coughs, cover sneezes, and then wash your hands. Wear a face mask only if you're sick or in contact with somebody else who is sick that doesn't have a face mask to wear. Meaning if they're wearing a face mask, you don't have to. The CDC only recommends going to the hospital if there are serious signs or symptoms, and these symptoms are stuff like trouble breathing or shortness of breath, persistent and steady chest pains, new confusion or inability to arouse. Now, this would be something that would be found out by a family member. If somebody who's sick all of a sudden doesn't act mentally the same and they're hard to wake up, or if they start having bluish lips. These are all suggestions of the CDC, and I'll put that up also as we're talking. And now to wrap this whole thing up, I just want to talk now as a medical provider, as a paramedic, both in the critical care field and the 911 field. I'm not taking this not seriously, but one thing that worries me further on top of everything else is how stressed the medical system is becoming right now. People are unfortunately flooding to the ED at minor signs of anything out of the ordinary. So to sum this whole thing up, I think it's very important that we get information from two sources, CDC, World Health Organization. I'll have a series of links in the descriptions on which I got all the information today that I disseminated for you guys, as well as links that will lead to other links, and you could better inform yourself. Secondly, take the appropriate precautions as suggested by these two sources, and do so without stressing ourselves out. Make sure you take care of yourself, both physically and mentally. We shouldn't be worrying ourselves into the dirt, because that's just going to make everything worse. And number 3, if you have any worries or concerns that you don't feel like you can be answered by the information, the CDC and the World Health Organization, call your primary care physician and seek advice there. All right, so that's the video. Make sure to wash your hands, take a breath, take proper precautions, and see you at the next one.